Hello everyone and welcome to our DualFUSION training module. This is training module number 1, Delamination 1. In this module, we'll talk about market segmentation, health injuries, and legal implication of delamination, lamellae characterization and formation, and factors that contributes to delaminations. Alright, so focus market and market segments. So we are focusing on the pharmaceutical industries, and the pharmaceutical industry can be subdivided into three major umbrellas or three major subsegments. The biopharma market, which are companies that manufacture large molecules or biologics. The chemically synthesized molecules or drugs. So these are traditional medicines, and aspirin is a prime example of a chemically synthesized drug. And then lastly, the IVD market, IVD diagnostics, and really this market, this IVD is funny. Some people consider it to be part of the pharmaceutical industry, and others consider it to be part of medical devices. But for this presentation, we will consider it part of the pharmaceutical industry. Biologics, really, what are they? They are drugs that are derived from living things. So it could be proteins, DNA, RNA, antibodies, etc. And we can see that we looked at the manufacturers of these biologics, and we subdivide them into three different types: APIs, originators, and biosimilars. And this is an example account of each to give you an example. So AbbVie, they would be manufacturing brand new biological products, while Sanofi will look at what AbbVie have produced and produce a biosimilar or a generic form of that drug. Chemically synthesized drug, again, these are small molecules. When you never think about chemically synthesized drug, think about aspirin. And again, similar segments. So some people manufacture the APIs, some people manufacture originating or original drugs, and other may manufacture the generic. And here's an example account. I want to bring your attention to Pfizer. So Pfizer serve as an example account of originator of a chemically synthesized drug and also biologics. So they do both. They manufacture drugs that are chemically synthesized and also protein therapeutics as well. So this is really taking a look at the different drugs that are available in the market and looking at their chemical composition and how they are made. Now this slide is taking a look of how these drugs are being administered to the patient. And we will see that there are three major routes of administration: topical, intral, and parenteral. And we're not going to go in much details, but really what's hot right now in the market, where a lot of money and a lot of opportunity lies is a parenteral and injectables. And then really it's just basically any drugs that is injected in the blood vein or any or anywhere else. And these drugs are usually packaged in vials, syringes, ampules, or cartridges, and these drugs can be both biologics and chemically synthesized drugs. So this is where the money is, this is where the market growth is, and you'll see a lot of different companies coming out with different products to target these audience. Okay, and we'll do the same thing. And for the next year or so, most of the new products that we will be pushing out will be in this arena right here: parenteral and injectable drugs. So really that was a market segmentation, and where DualFUSION being a new product, where would it lie? Now the focus of DualFUSION, or the marketing message, really is as simple as sample protection. So DualFUSION, we'll see through different modules, we will see how DualFUSION will play a huge role in sample protection, and drug stability. And therefore, we will be talking about delamination, extractables and leachables, and oxygen permeation. And each one of them, each one of these, each one of these um, each one of these topics will get its own module. Will be explored it in more details. We'll see how it does it cause instability to the drug, and how DualFUSION is able to is able to offer protection and increase um, sample stability. So that being said, so let's talk about delamination, and let's explore delamination a little bit further and see how DualFUSION is gonna help with the delamination issues. Number one is well, first let's start with does delamination really, is it a big issue? Is it a big concern? And if it is, why is it a big concern? So for that, let me start out by story of Amy Trehan. So Amy is she's a real person. She's a mother. She has 2 kids, and Amy unfortunately got diagnosed with cancer, um, Chorea carcinoma, on July 21st, 2010. Um, she was diagnosed, and she started her, as you can see, she started a treatment regimen 1 week following the diagnostic. She was taking methotrexate. Methotrexate is a common treatment or common drug used to treat different types of carcinoma or cancers. And while she was in that drug, she suffered from multiple lung collapses and several strokes. And this lung collapses and strokes had nothing to do with the cancer itself. The cancer itself was a uterus cancer, so it had nothing to do with the lung. It has nothing to do with stroke, and it would have not caused it. Now, on October 27th, 2010, we'll see a recall on the drug because of delamination concern. So really, we can say that all this unfortunate events that happened to Amy was because of delamination. And before we go into the legal action that Amy took, this is a picture or a slide that talks about methotrexate. As you can see, it is packed in a type 1 glass vial. It's a little bit expensive drug, and it is part of its formulation is alkyl hydroxide and carbonate. So it's the solution itself is a high pH, and when we see that, we know that any high pH will cause or have high probability of causing glass delamination. So this is the drug itself. Now the next few slides is going to talk about the legal battle between Amy and Sandoz, the manufacturer of methotrexate. Okay, so here's a case number if you want to do more research on it. But basically, first, if you take a look, so this is a little bit excerpts from the legal filing, and basically, whenever you see delamination in the news or any legal document, you'll see that it says delamination are small pieces of glasses that are seen by the naked eyes, and they will cause multiple serious health injuries such as multiple lung collapses and severe stroke. And we're going to talk about why did he cause these in a second. But so you'll see this, you'll be able to recognize these sentences over and over again with all the different recalls. Okay. Now Sandoz defense. So Sandoz is a manufactured generic form of methotrexate, and basically saying that since the originators, Pfizer in that case, has packaged the drug in a type 1 glass vial, then we should do the same thing. And we could not, if we have changed our primary containers, then we would have to file as with FDA as a new drug. Now, the judge opinions say no, this is not true. The law does not mandate that the container for a generic drug be exactly the same thing as a brand name drug, which is huge. And also that Sandoz or the generic manufacturer should do its due diligence and should work hard to make sure that delamination will not occur. So really, this story tells you that delamination is an issue. It causes a very severe pain and misery if it happen, or if it get injected into the body. And not only is a problem, it causes a problem to the patient. It was also cause a legal liability and a legal issue with a manufacturing company. Fortunately, in this case, Amy survived and she's doing well now, and the case has been settled outside of court, so you're not going to find a lot of information about her on the web. But we have on the S drive and with this module some legal documentation about the case. And of course, you can read and search the case itself. Okay. So moving forward, let's talk a little bit more about what is glass delamination, what is this glass lamella, how do they look like, and why are they able to cause such severe and very sad bad effects. Okay. So for the physical properties, if you're looking at the size and look, they are 1 micron or micrometer thick, and they range in length from 15 micron or 15 micrometer up to 1 millimeter in length. So they can be very large, or they can be very small that you can't even see them by the naked eye. And usually they have to be a huge size of them, 100 to 75 750 glass lamellae in the container in order for you to see it, and that's what they look like. Now, very important thing about glass lamellae or glass delamination, this is the last step of glass corrosion. So the chemical attacks the glass way before these lamellae form, way before delamination occur. So this is all at the end. So Jeff was going to talk about extractives and leachables, and that would be a good early test for delamination to occur. Again, so these physical properties, that because of their size, because they're very large, what they are able to do is they're able to obstruct the air and blood flow. So basically here we have the different major vein and arteries, and then basically this is the inner diameter, how the diameter of each of them, and how likely it is to cause obstruction. So you can see that the capillary, the capillary is very small, 8 microns or micrometer in length. That's the diameter. So 2 or 3 glass laminate can, if they are injected, they can block that right away. And then what happens when this happens? This can cause this multiple stroke or lung collapses. Now, this second slide really gives you an idea of the size and how big micron is, and how big or how small these glass laminates are. Okay. So we talked about their physical property. Now let's talk about their chemical composition. Are they glass? Are they subset of glass? Are different chemicals? Are they extractables? Are leachables? What are they? So in this experiment, what they did is they took one glass lamella and then they subjected to X-ray to find out the chemical composition of these glass lamellae. Okay, and what they find out is each one of them, it contains silicon, aluminum, sodium, oxygen, and boron, and it contains them at the similar chemical ratio, or similar chemical ratio as of glass. So they are glass, and delamination can only happen in glass. It cannot happen anywhere else. Okay, so so this is confirm the fact that glass lamellae are in fact glass, and they are coming from the glass vial. They're not coming from anywhere else. And this is really how you differentiate glass lamellae from, let's say, some of the particulate that comes from the rubber stoppers. Okay, so now that we know that these are glass, now we're going to shift gears and talk about the different factor that influences the lamination and the forming of these glass laminate. So first of all, whenever we talk about delamination, we are talking about the probability of the probability of delamination. So we're not saying yes or no, we're saying increased probability, higher risk, and higher risk. So we're using really this kind of language. So it's not a yes or a no. It just we're able to say yes. This chemical composition, this manufacturing process, these chemicals cause higher risk of glass delamination, or causes higher probability of glass delamination to occur. If we look at the different influencers, we will see that glass composition and valve manufacturers really account for 30% of these influencers, and drug formulation accounts to 70%. So basically what we are saying here is it doesn't matter how hard you change your glass composition, it doesn't matter how hard or you change your valve manufacturers, this all accounts to 30% of the influences. It's all about drug formulation. It's all about that drug reacting and interacting with that primary container or with that glass vial. So again, this is a similar graph, a similar table, and really talks about the influencers of glass delamination. So it starts with the glass chemical composition, the valve manufacturing processes, the coating, if we are putting a coating such as SiO2 coating or siliconization, and then also post manufacture treatment, so depyrogenation, Wi-Fi rinsing, and autoclaving. So all of these influences the formation of lamellas, or the formation of or the glass that delaminates. And in green, this is going to be a separate module itself. It basically talks about the drug and container interaction and how the different characteristics of the drug increases the probability or increases the risk of delamination. Okay, so now let's talk about type 1 porosilica glass. And what I have here is a little bit of introduction video on glass and glass composition, and why the inherent makeup of glass is the one that makes it vulnerable to delamination.
Glass plays a role in many aspects of our lives. One particularly important area is the pharmaceutical area. Here, glass needs to satisfy high standards. The quality that we have today largely results from scientific and practical experience. But where does this glass come from? Glass starts out its life as sand, which in its purest form is called quartz, a mix of silicon and oxygen. Surrounded by 4 oxygen atoms, this silicon forms a tetrahedron. To simplify this, the structure will be shown in a 2-dimensional way. The overall structure demonstrates perfect symmetry, as in a crystal. Glass, as we know it, has an amorphous structure. Its structure changes from crystalline to amorphous when the quartz is melted at around 2000 degrees Celsius and rapidly cooled down to ambient temperature. This quartz material offers excellent resistance against water attack. There is basically no interaction with water. Because it is so pure, it is quite expensive. As silicon-oxygen bonds belong to the strongest in nature, it has a very high melting temperature. These are the main reasons it is not suitable for bulk production or pharmaceutical containers. To make the glass more economically feasible to produce pharmaceutical containers, the melting temperature needs to be decreased. This is done by adding the so-called network modifiers. Typical network modifiers are alkali and alkaline earth metals, such as calcium, sodium, potassium, magnesium, lithium, and barium. For ease of understanding, only sodium will be mentioned here as a representative of all. These network modifiers loosely connect to the silicon-oxygen tetrahedra to widen the structure, meaning that less energy is now needed to melt the glass. The melting temperature is decreased. A disadvantage of adding network modifiers is that they also decrease the hydrolytic resistance. This means that there is more reaction with water. Water consists of an oxygen with two hydrogens. In contact with water, the glass surface exchanges a network modifier for a hydrogen. In this case, one sodium goes into the water and one hydrogen goes into the glass. The more network modifiers are removed from the glass, the lower is the hydrolytic resistance. For specific pharmaceutical applications, like solutions that are injected into the body, a certain minimum hydrolytic resistance is required. Thus, to re-strengthen the glass, boron and aluminum are added. They are integrated into the network and increase the resistance against water attack. Now, fewer network modifiers are exchanged for hydrogen. The melting temperature is increased a bit, but the hydrolytic resistance is increased significantly. This is the typical structure of a borosilicate glass type 1, which can be used for injectables. The quantity and the ratio of network modifiers in the structure determine many of the chemical and physical properties. If, for example, more calcium is added to the glass, the melting temperature of the glass is decreased again, and in turn, the hydrolytic resistance is also decreased again. This structure shows a soda-lime type 3 glass, which is only recommended for packaging oral solutions and tablets, but not injectable liquids. In general, the higher the hydrolytic resistance of the glass, the higher the quality of the glass, as there is less risk of interactions with the drug formulation. The quote from Schott's founder, Dr. Otto Schott, "Glass is not just a pure coincidence," is today even more relevant than ever. Schott. Glass.
Okay, so as the video was mentioning, really the chemical composition of borosilicate glass is, is very interesting, and also is a one that is that gives glass its characteristic, and also it gives an idea of the probability of it being delaminated or not. They do not talk about delamination, but it is true. So here we have really a table. First thing we want to say that not all borosilica type 1 glass is alike. Each company has its own formulation, and each company has a variable amount of silicon oxide, boric acid, or boric oxide, and aluminum oxide. So the chemical composition varies from one company to the next. And in general, the higher the SiO2 content or silicon oxide, the better the glass. Okay. So so this is an example of the different type 1 glass formulation, and the companies that they have it. Now that begs a question: is does this changing this chemical structure, does this has an effect on extractables and leachables, and does it have an effect on delamination? And the answer is yes. If we change the chemical structure, we will change the likelihood or the probability of having of a vial experiencing delamination. So in this experiment, what Gersheimer did is they changed the chemical composition of glass. So silicon oxide, they increased it from 79.6%, they increased it to 79.8%. So this is very small, but you will see how dramatic the effect is. They also increased the aluminum oxide. What they decreased here is sodium oxide and boric oxide. Okay, so these are the two they change, and really the sodium is the enemy in glass. in terms of extractables and leachables. And again, this is a network modifier, so they decrease it from 4.2 to 4.0. So once they did this, they ran an experiment in really they checked for extractables and leachables, and then what they did is they took these vials, they put different solution in them. So NaOH, so this is a very basic solution, citrate buffer. This is NaCl, or basically salt. And what they did is they wanted to check for the silicon, basically the silicon dissolution as in extractables, and also the EP of the vial itself. And as you can see that basically this is 0, so this is original, this is phase 4, so this is a chemically modified, or when we change the chemical composition of the glass. And you can see that we absolutely did decrease the amount of extractables. In this case, silicon. So silicon used to be, we increased it sometimes by, we went from 60% to 45%, so we increased it by very big margins. Okay, so that was a chemical composition of glass. So now we know that if we change the chemical composition of glass, we're going to change the likelihood or the probability of having the vial to be delaminated. Now number 2, or the second factor or influencer, is the manufacturing processes. So this is a diagram of the manufacturing processes of vials. Basically, you start with a glass tube, you apply heat at a certain temperature and at a ramp up temperature, a certain ramp up or acceleration of temperature, and you do tooling, and then you have the finished form. So this is the top of the vial, and you convert it, and then you apply heat at the bottom of the vial, and basically you seal the vial, and then you drop this vial, and then the cycle continue on to manufacture the next vial. Okay, so the idea here is, does this manufacturing processes, can we do anything different that can increase or decrease the probability of delamination? And the answer is yes. Again, Gersheimer, what they did is they take a look at the vial, and they took a look at which regions are more vulnerable to delamination. And what they found out is a region that have been in contact with high heat is a region that causes delamination. So right here on the bottom, and also right here on the neck. So these two causes macro, means large amounts or large pieces of laminate, and here's what happens micro, so not a lot of stuff happen here. So there's a lot of different theories of why this occur, but basically without getting into too much details, is when you apply a lot of heat, some of these network modifier like boron or boron oxide, they evaporate, and then what you have is a different chemical structure here of glass that is more vulnerable to delamination. So this is the one sentence or two sentence answer, but of course this is in there's a lot of different theories behind it, but this is the most widely and accepted theory. So basically here what we're saying is that okay, so if we change these parameter of manufacturing, then we can change the likelihood of delamination, and the answer is yes. In here we'll see some scientific evidence that says basically that yes, the chemical structure at the wall in this region is very different than the bottom of the vial. Okay. So basically, so there are the two. So whenever you hear the word delamination control, delamination control vials or Vial-X or any of these vials, really what they are doing is they're either changing the chemical composition of the glass by a very small percentage, or number 2 is they are changing the manufacturing processes of the glass, of the vial. So it's either they are decreasing the temperature or at which the vial is formed, or slowing down the converting steps, so you don't have a very high ramp up or a very high acceleration of temperature. Okay, so that is manufacturing and making the vials. Now the second step, what a lot of people are doing is or not a lot of people, but in this case shots, what they're doing is they're saying, let's forget about the chemical composition of the glass. Let's apply a coating, and let's apply SiO2 coating. So SiO2, silicon oxide, as you've seen from the video, this is basically the purest form of glass. And then so if we use that as a coating, then we have a lower risk of delamination, or a lower risk of having a lot of extractables and leachables, and it works to a certain degree. But before we talk about the results, let's talk about the manufacturing processes. So shot, again, it produces type 1 plus vials, and these vials do have the SiO2 coating on them. So basically, they manufacture a regular vial. The vial comes in, it gets cleansed by water. After that, it goes through a microwave, and basically you activate the surface by applying oxygen. So this is a plasma treatment right here. After that, you introduce the coating gases, and really what the coating gases are in this case is silicon oxide and some other noble gases that can help facilitate the reaction. You allow the reaction to take place again via plasma, and then bam, you have your SiO2 coating on that side of the plate. Now this SiO2 coating, again, it works, but it has its limitation. So this is really the experiment to show that the SiO2 works but has its limitation, and we're going to talk about it in a little more details. So basically in this experiment, they took uncoated vials, so these are regular type 1 borosilicate glass vials, and shot type 1 plus or coated vials. Okay, and then basically they stored them for 3 to 6 months with 3 different buffers. So the buffer that they use is phosphate, citrate, acetate, and they store them again for 3 to 6 months. So they filled the vial with these different buffer, let it sit, and I think it was at 50 degrees for 3 to 6 months. And then what they did is they checked for the different extractables and leachables. So they were looking for the different metals in this case. So in here they looked at aluminum, and you can see in the uncoated vials, you can see that it was pretty high, especially if you put citrate buffer into the vials. It leaches a lot of aluminum. And then if you look over here, if you see the SiO2 coated vials, it did not leach as much aluminum as uncoated vials. This is the same case with boron, and same case, I think, not here, but in 3 different metal ions. Okay, sodium has a similar profile as well. Okay, but if we look at silicon, okay, this is a very interesting part. So silicon, the amount that leached in the type 1 plus vials was more than the uncoated vials. So that SiO2 coating itself, is leaching. So basically this graph, what it's showing is that all of these buffer, phosphate, citrate, or acetate, had interacted with the SiO2 coating, compromised that coating, and allowed for the silicon to dissociate and come out into solution. Okay, and this is why it's higher in phosphate, citrate, and acetate buffer. Okay. Now the other thing that you can get from these graphs is the fact that the longer you store your product for, the more delamination, the higher probability of delamination that occurs, and the more extractables and leachables you will see. Okay, and that is very common here in all of them. Okay, so citrate buffer here for the uncoated at in 3 months we had 10 milligrams per liter of silicon, but in 6 months that almost doubled, so it went to over like 19 or so. Okay, so this is saying that SiO2 coating helps, but still has limitation. Okay, now this is great. So we talked about coating, we talked about manufacturing processes, and we talked about the chemical composition. But as we know that if we are targeting the parenteral market, we're going to take these vials, and these vials has to go to post-manufacture treatment. They're going to have to go through a depyrogenation oven, they're going to have to be rinsed, and they're going to have to be sterilized or autoclaved. Okay, and I'm not going to talk in too much in details about what happened to that glass vial after these steps, but basically there's a general rule, and basically there's a general sense that if you every time you take the vial and expose it to heat or water, you increase the risk of delamination. Okay, so depyrogenation increases the risk of delamination. Why? Because it's the high temperature. Rinsing, the same thing, it increases the risk of delamination. Why? Because the interaction of water with the glass. And sterilization would be the same thing, especially if we talk about autoclave where we have steam. So right now you have both high temperature and also water. And again, any interaction with water or heat is going to have a negative effect on the vial, as it increases the risk of delamination. Okay, so in summary, really delamination occurs, or lamellae formation occurs as the last step of glass corrosion. So glass corrosion happen early on, glass attacks happen early on, and at the end, after everything's said and done, then you'll see this glass lamination. Changing the chemical composition and changing the manufacturing processes can affect the risk and the probability of lamellae's formation. And again, was 95% certainties the DC delamination control vials by shots and the vial X by Nepro. All they're doing is either they're changing the glass composition or they're changing the manufacturing processes, and most likely they are changing manufacturing processes because it's extremely difficult to change the chemical composition. So they're basically changing the speed and the temperature at which the vials are being manufactured and formed. And again, putting everything together, the different influencers of glass lamination is the chemical composition of the glass, the vial manufacturing processes, the coating, if we put an SiO2 coating, or siliconization, and the post-manufacturing treatment. And we did not really include siliconization in this module because you cannot sterilize siliconized vials, so they're not going to be part of our parenteral container, our parenteral packaging solution. Okay, so thank you very much, and look forward to our next modules. Thank you.